A mother brings her 6-year-old son to this clinic in Rota in Western Kenya looking for help. At 21 kilograms, he's underweight and can barely stand on his own. He has severe malaria. His mother says he's been sick before, but it's never been this bad.
He has been sick this morning. He woke up with a very high fever and started vomiting. He also has diarrhea, so we rushed him to the clinic.
Another mother says both her children too have been ill for days. Children under the age of 5 are most at risk of contracting and dying from malaria. The clinic sees about 40 patients a day, many of them diagnosed with the disease. The high temperatures and stagnant water in this area mean mosquitoes, which can carry and pass on malaria, are able to breed easily. Half the people living in this area have malaria. The rainy season has just begun here in Kisumu County, and that's normally when the number of malaria cases increase dramatically. A pilot program to vaccinate almost 250,000 people in areas just like this one will begin later this year. The vaccine trains the immune system to attack the malaria parasite, and it's hoped it will potentially save tens of thousands of lives, especially as some strains of malaria are resistant to drug treatment.
We are realistic that we are dealing with a very clever parasite. We are dealing with also clever mosquitoes that develop resistance to all chemicals, insecticides that we develop. But over the last 20 years, we have seen the number of cases drastically drop in Africa.
While the number of malaria cases have dropped by as much as 70% in some places in Kenya, the World Health Organization's 2017 malaria report says last year there were about 5 million more cases of malaria globally compared to the year before, and that more than 420,000 people globally died of the disease that year. 90% of those cases occurred in Africa. There's now hope that a successful rollout of the vaccine across 3 African countries will mean fewer deaths. Fahmida, Al Jazeera, Kisumu County, Kenya.